and it is believed that symptoms may appear in as few as 2 days up to 14 days from exposure to the virus. In a summary that was published 3 days ago of over 72,000 cases documented in China, 87% of those individuals were between the ages of 30 and 79. There were no pediatric deaths reported in this case series, and the case fatality rate for this study was reported at 2.3%. Again, as I mentioned last time, this is not our first outbreak of a virus from the coronavirus family. Much of what we learned in 2002 from SARS and in 2012 with MERS is serving as a template for what we are learning today. For comparison, experts still believe that this infection is deadlier than the seasonal flu, but less deadly than SARS. We believe this is more contagious than the seasonal flu, perhaps as contagious as the common cold, and far less contagious than chickenpox or measles. We also know that through good medical care and by following guidelines from reputable public health sources, we were able then to avoid in the United States the levels of illness seen elsewhere in the world, and so I believe we need to approach this new challenge in a similar fashion. To date, the vast majority of cases have occurred in mainland China, but we have seen evidence of community spread in Hong Kong, Iran, Italy, Japan, Singapore, South Korea, Taiwan, Thailand, and I anticipate that this list will grow. As of last night, 15 cases have been diagnosed in the United States, with the first case in an individual who was not exposed to anyone known to be infected with the coronavirus and who did not have apparently any travel to an at-risk country. So this brings the total in the United States to 60 if you include the 45 Americans who were repatriated from China aboard the Diamond Princess cruise ship. The 15 US cases have occurred in 6 states. 12 were related to travel. 2 were household contacts of people in that group of 12, and then as I mentioned, we had the additional case last night. Again, I expect this number to grow as well. And although we have no cases currently in Monroe County or in New York State, I am preparing as though we will. Here in Monroe County, in accordance with the CDC and the New York State Department of Health, we began instituting a 14-day voluntary quarantine for travelers from mainland China beginning on February 1st, using lists of individuals that we had received from Border Patrol and the State Department of Health. As of this morning, we have 11 individuals under voluntary quarantine, and 20 have completed their 14-day period without incident. As I said, I believe the incubation period is 14 days at most, and we believe that person-to-person spread occurs primarily from symptomatic individuals to susceptible hosts. Again, to review, quarantine applies to individuals who have, in this case, a travel-related risk factor and who are otherwise well without any symptoms. Isolation, which we have not yet had to do, would apply to individuals who we suspect are ill and who may have some of the additional criteria that we would use to test for coronavirus. Again, I anticipate that the guidance for quarantine and isolation will continue to change in the coming days and weeks. I have been in close contact with leadership from our local hospital systems to ensure that we are all reviewing guidance coming from the state for healthcare settings, the most recent of which came earlier this week. I've also been in touch with the Monroe County Medical Society to ensure that we have good communication with our physician and physician office partners. I've been in touch with many of the superintendents from our K through 12 districts, local colleges, universities, also to call their attention to the guidance that is coming down from the state. There have been a number of questions regarding testing and the availability of test kits, so I want to speak directly to this concern. First, I want to remind you all of the current recommendations related to testing. In accordance with CDC guidance, testing is performed when there are the appropriate epidemiological risks and the appropriate clinical features. Again, to date, we have had no one meet the criteria for testing. Currently, the test is available only in the CDC in Atlanta, which is obviously a concern that state and federal officials are working diligently to rectify in anticipation of when testing might be more necessary across a broader community. Right now, we do not have a clear understanding of how testing will impact our approach to diagnosis and risk planning, so not having tests locally has not yet become a problem. I am confident that we will learn more about how and when to conduct testing in the coming days and weeks, and I also am confident that we will have greater availability of these test kits. Once we do, we can then incorporate testing into our medical and public health algorithms. At this time, we do not think there would be any value to screening, testing asymptomatic individuals. And on that topic, I want to call special attention to the importance of the epidemiologic risk. The risk currently is travel or contact with somebody who is sick. The epicenter of this epidemic happens to be in China, and so the vast majority of those infected are Chinese. But I want to emphasize that travel through China and travel through affected parts of the world is the primary risk at this time. As the situation unfolds, we will see other communities impacted and very likely an expansion of the list of countries included in the epidemiologic risk category. So I want to caution ourselves to be mindful of stereotypes, profiling, and stigma, which have no place in managing a community-level public health approach. I also want to address the issue of masks. I want to be clear on this. Masks are an important protective measure when used properly, in the right setting, and by the right people. Used in any other way, they create a false sense of security, and we risk not having them when we will need them the most. And that will certainly hamper our ability to keep people healthy and to prevent the spread of illness when the time comes. For the general public and for people who are well, the CDC does not recommend the use of face masks or respirators. Outside of healthcare providers and first responders, patients with confirmed or possible COVID-19 infection are the only individuals who should be wearing a face mask. Healthcare personnel should refer to their institutional infection prevention guidelines on further assistance as to when to use protective equipment. And so again, I want to be clear. People who are well need not wear a face mask or a respirator. The benefit of either to the general public is virtually zero at this time, and again threatens to deplete the future supply that could be vital for healthcare providers and first responders in our community should that need arise. While there is still much that we continue to learn about COVID-19, I agree with the CDC that it is not a question of if, but a question of when we will see community spread within the United States. My goal is that we are prepared as a community for when that time comes, that we work together to minimize illness as much as possible, and that we act based on information and guidelines from reliable sources. Let's remember the steps that we can all take, steps that we know are effective in preventing the spread of respiratory viral illnesses like COVID-19. First, practice good hand hygiene. I know I say it often, but it is probably the most important step that we can take. Wash your hands, especially before meals, after coughing or sneezing, or when you're about to touch your nose, mouth, or eyes. Wash with soap and water for 20 seconds or more, or when your hands are visibly dirty. An alcohol-based hand sanitizer is also an effective alternative, and if you need to cough or sneeze, please use a tissue and discard it, or cough or sneeze into your sleeve. For schools and businesses, please encourage employees and students who are ill to stay at home as you normally would. Avoid travel if you are sick. Ensure that you have an adequate supply of tissues, and for our little ones in daycare settings, please make sure they're washing their hands. These are good practices in general, especially to prevent the spread of influenza, which remains very prevalent in our community, and these are good habits to practice now in the event that COVID-19 is confirmed in our community at a later point in time. If you are traveling, there is a CDC website that summarizes the up-to-date guidance on how you might consider your travel plans, and we can provide that link on the website later on today. I know this is a lot of information, and I realize that some of this can feel unsettling, and so I'm hoping I can close today by summarizing the key points of what I just said and offering some perspective. While there are many details that we are still learning about this novel coronavirus, we've dealt with global outbreaks from novel coronavirus in the past, and we know that sound public health measures are the best way to minimize the number of infections and illness in the United States. We have developed a series of plans here in Monroe County based on science and past experience, We have updated and practiced these plans, and we are using these plans right now. And we know that even the best laid plans sometimes need to be tweaked. We also know that this is a rapidly evolving situation, and so I'm in constant communication with my counterparts across the state, and I know my colleagues in Monroe County government are also in touch with their counterparts as well. As I've said, coronavirus is concerning because it's new, but influenza is serious because it's here, and it has been for months. As of February 15th, we have now confirmed over 4,200 cases of influenza. We've had at least 539 hospitalizations, and I heard the other day of one additional fatality, bringing that total to 6. It is not too late to get your flu shot. It is still available at local pharmacies, your doctor's office, or the Monroe County Health Department. I want to take this opportunity to thank my staff in the health department who have been working tirelessly for the last month, working hard to protect our community. I want to remind you of our Twitter website at Monroe Health. Please stay tuned for further updates. And with that, I will entertain questions.
So you're saying that people who are well need not wear a face mask. Can you tell us why people who are well don't need to wear a face mask right now?
Because people who are well are not contagious. They have nothing to spread. And wearing a mask would not protect them from somebody who is. We know that this is spread through airborne respiratory droplets, and the average mask is not sealed well enough for the average well person to feel protected. So our view is that it's really a false sense of security and frankly a waste of good masks.
Outside of flying or taking a cruise or whatever, how else can the virus come into our country? I mean, can it linger in products that are shipped into the country?
Yeah, we have no reason to believe that the virus will live on a surface and make it through the border on a package or on the surface of an object. We believe that this is person-to-person spread.
Doctor, you talked about youngsters in schools. We've seen the flu run rampant throughout schools and stuff. Are you working, in addition to working with local health officials, are you also working with schools within Monroe County? I don't know if Adam, the county executive, wants to address it, or you, or just...
You know, our advice to all people is get the flu shot. That is the most important step that one can take to prevent the spread of flu. And then beyond that, the good hygiene measures that we talked about. That cannot be overstated.
Are there special guidelines, suggestions for businesses that do have employees traveling to that area or areas where there's an impact?
What I would say is to consult the CDC travel website, and there, depending on the country and what's happening, at that moment, that guidance is changing very rapidly. So I would hesitate to offer anything now, since it often changes.
Can you describe for us any of the protocol that would be in place currently for isolation versus quarantine?
So in the instance of isolation, so that would be somebody who we believe is either a suspected or a confirmed case. We would obviously be paying very close attention to them. It would be far beyond what we're doing for our voluntary quarantine. We would be following that person's whereabouts much more closely. We'll be following all of the contacts that may or may not come in to that person's physical space. But most importantly, since things are changing so rapidly, we will be working very closely with the State Department of Health to use whatever the guidance is at that time for how they would like us to manage a situation like that.
Dr. Mendoza, I want to piggyback on the question regarding schools. I know that the Monroe County officials are talking to schools and superintendents about the plan. We've seen schools in Hong Kong and in Japan close. At what point are we going to go that route if we have to?
Certainly, we don't want to have to close a school down unless there is good reason for that, and that's not a decision that we're going to take lightly. We haven't yet spoken with the schools very closely, and frankly, we haven't gotten any guidance yet from the CDC on the circumstances that would prompt such a move. And so I think that's something that is part of our planning going forward. But certainly, we're not going to want to close a school unless it's absolutely necessary, and we're going to, only consider that with, strong guidance from the Department of Health and the CDC.
Can you say now, if someone were to become ill with respiratory problem, especially given that flu is prevalent, what should they do? Should they go to a doctor? Should they go to the hospital? Should they sit at home and wait to see if the person
Well, we would certainly rather they call us first. They can, most likely, the best person to call would be their personal physician or personal clinician. If they've got questions in general, we're always available at the health department. What we don't want is somebody who is potentially contagious with something, whether it's the flu or anything else, to just show up at our ER. You know, we would want to make sure that, you know, we have an opportunity to call in advance if we know that they need to go to the ER, and so that's something we want to be able to try to do in advance of them getting in their car. But certainly if somebody's very ill and would need to go to the ER anyway, then obviously go to the ER. We don't want people to not go if there's an emergency. But in general, for people who, you know, might be feeling, you know, a little tired or have some milder symptoms, we would much rather talk to them on the phone first.
You say that they're going to distinguish between without testing, which you can't do.
You know, that's something that, you know, what we know about the COVID-19 is that they're primarily lower respiratory symptoms. So the fever is generally present, and then cough or shortness of breath, which, you know, are symptoms generally of lung. And flu is generally, you know, muscle aches and upper respiratory symptoms. But, you know, that's not the kind of thing that we want people wondering about at home. We would much rather they call us and have a trained professional sort of triage that situation for them.
Has there been any, I don't know, panic's the right word, but are urgent cares and ERs seeing more people come in and say, I don't know what I have?
I can't speak to that. I would assume yes. Is that what you're seeing?
Can you please come to the podium?
We haven't seen a substantial change in the number of patients who are coming to the urgent care and the EDs relative to this complaint, but we certainly have had patients who've called our primary care practices and our EDs that we've been able to walk through the symptom evaluation, and in a few cases we have been following them based on our concern, but we've had no patients, as Dr. Mendoza has said.
Dr. Mendoza, when you say that the current risk level is low, what other levels of risk are there? Do they have names, and what determines when it's no longer low?
We'll take our guidance from the Department of Health on that. I mean, it's low, medium, high, basically. But we'll take our guidance from the Department of Health as to when those criteria are met.
This question is for County Executive Bello, if you don't mind. There's upwards of $40 million available. How will that money be used, and how much of it is potentially coming here to Western New York?
Yeah, that's a good question. We don't have the details on that yet of how those funds will be distributed, so we'll be in touch. Obviously, we are in touch with the New York State and the Department of Health and our representatives. So we'll have more information, hopefully, about that in the coming weeks. And that was also the subject of my conversation this morning with Congressman Morelli about making sure that we have federal resources here. He's very obviously concerned to make sure that we have the resources we need here to, if we need supplies and things like that in the coming weeks. So we'll be having those conversations again this weekend. I know he's being briefed, I believe, this afternoon by the CDC. And we'll have more information about federal funding coming home, hopefully, in the next couple days and weeks ahead.
I have one more question, if you
Sure.
don't mind. In certain places, other countries, we've seen a shortage of food at the supermarkets. Obviously, we're not trying to cause a panic here.
No.
But
Yeah.
what should people do? Should they start stocking up right now? Get
No.
2 weeks worth of food and all that?
Yeah, I think what people should do is be aware, follow the news, and continue to check our website for updates as well. We will put right on the front page of, again, monroecounty.gov, links to all the relevant resources at the New York State Department of Health and the National CDC. And I would take direction there. I don't think there's any reason right now to panic and have that level of alarm to stock up like that. But as the conditions change, and if there is a reason to do that, obviously we'll bring you back here and update the public on that as well.
How are we doing on the supply of things that we would need, masks, other supplies?
Yeah. The hospital systems want to see them?
Right now, we're considered safe. We monitor closely on almost a continuous basis our supply of masks and protective equipment. We have meetings upwards of almost 3 or 4 times a week. But and we continue to look for other alternative sources. Many sources are in Asia, but there are increasing number of sources in the United States. So that's some positive news about that. But that said, we don't want to waste masks. We want to use them smartly, but we monitor it very closely.
County Executive, just real quick, if you could just sum up the message you would send to county residents tonight. I mean, I know we're
Right.
You know, not panicking, just, you know, the whole idea of just gathering here today, I mean, just what you're trying to, you know,
Yeah.
say to people, because there is a lot of unknowns and you're still trying to grapple with, you know.
Exactly. So, and I know there's still a lot of questions out there in the community. The message I'd like to send to residents in Monroe County is that we are working very hard here in our efforts, in our role to coordinate the various entities around our community that are engaged in efforts of public safety and public health. And that is something we've been very focused on the last several weeks, since the last time we addressed the media on this a couple weeks ago. My goal is to make as much information as possible available to the public so that they have information to be able to protect themselves and their families as well. I think we should be very grateful as a community to have Dr. Mendoza in our Department of Health, who's been working on this, and our two hospital systems have been coordinated and collaborating. And so we just want the community to know that we are coordinating here our public health officials, our public safety officials, the educational systems, the colleges and universities, as well as law enforcement. And others, to make sure that we have the resources in place and people are prepared in the event that there is a community spread here, which right now there is not. And also to be able to dispel myths that might exist out there as well, and be able to answer all the questions that you have, because obviously there's a lot of concern when you turn on the news and see breaking news, community spread here, or what's the situation with travel advisories and things like that. So it's very important for us to make sure that we have the professionals be able to talk to you and our residents to get the right information out there, so that there is not undue panic or misinformation out there in the community.
Well, what should people do differently? I mean, just live
Well,
your normal everyday life, right?
Yeah, I mean, I take the advice from the doctors who are here, but absolutely, at this point right now, there's no reason to be alarmed. We have had the voluntary quarantines in place for several weeks now. I believe Dr. Mendoza said there's 11 right now, and there's 20 that have successfully gone through the voluntary quarantine. So we want to be upfront about that and what's happening. But until the conditions change, there's really no reason to do anything different here, except what you would normally do in the season that we're in, which is, again, to take care of your health. Again, the flu is still much more prevalent and is still prevalent in our community. Make sure you get the flu shot. And also just to be able to give residents the place to go to get information should the condition change. So if you're watching the news tonight, or you're seeing things around the country that's being that's alarming you or your family, you could go to our website, you can call the New York State Department of Health, and we just want to make sure we get that information out there. But right now, I don't see a lot that residents need to do right now, other than to just be aware.
Can I ask you on topic?
Can we do that off camera? Or,
Sure.
thank you. Or after? Okay. Okay. Any other questions about this?
One thing.
To me, or? Yeah.
There've been many references to CDC, to state health here. Can you or someone explain what are the lines of authority, if you will? If the situation were to escalate and there would be a need for steps to be taken that would impact the public, whether it be, you know, limiting public assembly or, you know, along that, who's in charge of what, and who would direct schools to close, who would direct whatever? You? Governor?
Sure.
Okay.
President?
Tim Palmer, I'm the emergency manager for Monroe County. Public health is the lead agency on this, so the public health commissioner would have the local authority, county public health. And there are escalating tiers of that authority, so State Department of Health, and then the CDC would also have some authority to do things based on the scale of what we're dealing with. In the event of some sort of scenario in which we're looking at closing areas of public assembly, it would be the county executive and a state of emergency action where we would issue an emergency order through the Office of Emergency Management to control those types of movements within the community based on the information we have.
Yeah, if I could just make a few comments regarding the hospitals and our preparedness for this, because that hasn't come up much today. I want to underscore what has been said. If people are ill with an illness like the flu and they're sick enough to contemplate coming to their doctor or to an emergency room, to call first. So we can expect you, we can meet you at the door, give you a mask to put on right away, take you to a room apart from other people, so that we protect the people around us and our healthcare providers as well, and other patients and so forth. That would be true for the flu as well as for a new coronavirus. So That just makes real common sense, and we would ask that anybody call ahead before they might arrive. If we do have patients that come to us in any of our hospitals with suspected coronavirus, even before we know that that's what it turns out to be, we do have facilities to isolate those patients, so it's a safe place for them to be, safe for everybody else in the hospital. We have special isolation rooms at Strong and at the other hospitals. And we are making pretty detailed preparations in case we need to hospitalize patients with coronavirus if it turns out we do have them in our area at some point in time. So I think it's important for the public to know that our healthcare system and our hospitals are doing everything that we can to prepare so that we can take care of patients to the high standard they expect and to do that safely for everybody else.
How much capacity would there be combined in the county among the hospitals, do you think, in isolation rooms like that?
I don't know the answer to that question for all the hospitals. And you also have to consider that the hospitals at this very moment are more than completely full, in large part due to influenza. At Strong, for example, we had more flu patients last week than we've had in the entire flu season so far. So our hospitals are full. If we were having to accommodate additional patients with, say, coronavirus, if it did occur, that would certainly be a stress on the hospitals, and we would need to try to find ways to create more space for patients. We do have dozens of isolation rooms at Strong, for example, and we have areas that we've set up in the past potentially to deal with Ebola or SARS if those ever came to our area in past years. So this is not the first time we've been through this kind of preparation.
Great. Thank you all very much. Appreciate it.